Pregnancy Week 12. Congratulations! You have reached the end of your first trimester and heading into your second trimester as you are now 12 weeks pregnant. It's good to know that the risk of miscarriage drops significantly during this time. Your baby bump may be more noticeable and you may even start showing it to the outside world. You may also feel some relief from the early pregnancy symptoms you've experienced. Your baby's growth continues with significant progress. Your baby is developing reflexes and growing fast at this stage. Week 12 Pregnancy Ultrasound. During the 12th week of pregnancy, an ultrasound can be performed for various purposes. It can help estimate the baby's gestational age and due date, as well as determine the size and weight of the fetus. The ultrasound can also screen for certain disorders, such as Down syndrome, and check the baby's heart rate. It can be used to count the number of fetuses, rule out ectopic pregnancy, and check the amount of amniotic fluid in the uterus. The location of the placenta can also be identified, and it can be determined whether the baby is growing and developing normally. Finally, the fetal spine is checked, and the nuchal translucency assessment can help identify any risk of chromosomal abnormality. Week 12 Size of the baby. At 12 weeks, the baby is approximately 2.1 inches long and weighs around 0.49 ounces, about the size of a plum. Week 12 Baby's development. At 12 weeks of pregnancy, your baby's vital organs and body parts will be fully formed, and their sex organs will have developed. Although your baby is constantly moving, kicking, stretching, twisting, and turning, you won't be able to feel these movements yet, as your baby is still small. However, as your baby grows and presses against your uterine wall, you will feel their movements more clearly. Your baby is also developing reflexes at this stage. Their fingers will begin to open and close, their toes will curl, their eye muscles will clench, and their mouth will make sucking movements. The placenta is now doing its all-important work of filtering oxygen and nutrients to help your baby grow. The kidneys are working to enable the baby to pass urine and swallow amniotic fluid. Your baby's vocal cords are forming, their liver is making red blood cells, and the pituitary gland is beginning to secrete hormones. Week 12 Pregnancy Belly. Around the 12th week of pregnancy, your uterus grows and moves up and out of your pelvis, forming the characteristic baby bump. It's important to note that every woman's pregnancy is unique, and even at the same gestational age, no two baby bumps are exactly alike. The size and shape of the bump can vary significantly depending on the individual woman's body size and shape. If this is your first pregnancy, you may not have much of a bump to show, but if you're expecting your second child or multiple babies, you may start showing earlier than first-time mothers. Week 12 Pregnancy Body Changes. Your uterus is growing rapidly, and your doctor may be able to feel it in your lower abdomen. The surge of hormones in your body can trigger various changes. You may notice that the skin around your nipple is getting darker, and there are darker patches of pigmentation on your face and neck, which are called cloasma or masks of pregnancy. Don't worry, these patches usually disappear or become lighter shortly after delivery. The increased blood volume may cause you to have that pregnancy glow. Those pesky pimples that have been bothering you for the last few weeks are probably settling down, making way for a clearer complexion. Week 12 Pregnancy Symptoms. Bleeding and sensitive gums. Increased hormone levels can cause gum sensitivity and bleeding while brushing or flossing. Bloating and gas. Hormonal changes and the expanding uterus can lead to bloating and increased gas. Tender or sore breasts. Your breasts may feel tender, sore, or even tingly as they prepare for breastfeeding. Increased vaginal discharge. During pregnancy, increased vaginal discharge is normal as long as there's no itching, burning, or foul odor. Dizziness. Changes in blood pressure and circulation may lead to periods of dizziness or lightheadedness. Increased sense of smell. Many women experience heightened sensitivity to odors during pregnancy, leading to nausea or aversion to certain smells. Excessive saliva. Some women may experience increased saliva production, known as ptyalism during pregnancy. Headaches. Hormonal fluctuations and changes in blood circulation can contribute to headaches during pregnancy. Week 12 Pregnancy Checklist. Schedule a dental checkup to ensure good oral health during pregnancy and address any dental concerns. Plan how you will reveal your pregnancy announcement to family and friends, so that you can celebrate this special moment with them. Start planning when you will tell your employer about your pregnancy, considering company policies and when it's most comfortable for you. Consume lots of calcium and prenatal vitamins as recommended by your doctor to support the healthy development of your baby and maintain your well-being. Consider baby names and create an initial list, considering cultural significance, family traditions, and personal preferences. Plan a baby moon vacation to relax and enjoy quality time with your partner before your little one arrives. Shop for comfortable maternity clothes that will accommodate your changing body and keep you feeling good throughout your pregnancy. Week 12 Pregnancy Tips. Remember to stretch and warm up before exercising, as your ligaments and joints are loosened. Avoid exercises that require you to lie flat on your back, such as crunches and Pilates, until after giving birth. Consider using a pregnancy or body pillow to support your changing body and help you rest more comfortably. Moisturize your belly, hips, and thighs daily to prevent itchy, dry skin as they stretch. Limit your intake of fats and sweets for a healthier pregnancy. Avoid consuming late-night snacks. For more videos like this, please like, share, and subscribe.